Hi, welcome back to the Academic Carnival. My name is Dr. Ryan Arthur. This is a very short and concise workshop on writing your dissertation. We will begin with Chapter 1. But before we begin, please download the Chapter 1 template, which is just below this video. If you go to the description box, you will find a download link. Please click on this link and you will be able to download the Chapter 1 template. Your chapter 1 should essentially consist of 4 sections, the first of which is an overview of your entire dissertation. This will be followed by your background. It's very, very important that you give background and context to your research. This will be followed by a rationale. Your rationale is a concise paragraph that brings together all of your arguments. In this section, you will really try to demonstrate the rationale, the reasoning, the significance of your research. The last part of this chapter, you will include your aims and your 4 objectives. This will end chapter 1. Now, look at your chapter 1 template. You will see 2 colors. Red, which you would state the aim of your dissertation, and in green, outline each chapter. I've colored it red and green in order to demonstrate what each part is doing. The first part is where you state the aim of your dissertation. This study will do such and such. In this case, this study will explore the barriers to the uptake of screening for early diagnosis of breast cancer among black minority ethnic women in England. A very direct aim is very clear what this study is about. And in green, the student has outlined each chapter. Chapter 1 will do this, Chapter 2 will do this, Chapter 3 will do this. But more so, what the student has done, she's explained the role of each chapter. What is Chapter 1 doing? What purpose is Chapter 2 doing? What is Chapter 3 doing? And she really explains this in a very concise and straightforward manner. What follows is state the problem. It's very essential that you state the problem. What is the problem that your research question suggests? Really try to problematize your research question. You have to create a problem scenario, create a sense of urgency. It's increasing, the rate is increasing, the burden is increasing, the prevalence is increasing. What this student has done in regards to her dissertation on investigation into the physical and psychological consequences of childhood obesity among primary school children aged 4 to 11 years old in the UK. This student has really tried to create this problem. Childhood obesity has been growing. It's a growing health burden in recent years. And more so, she points to the lack of data, the lack of information. So she has a twofold problem here. So she's made her research question into a problem, and she started her chapter, she started her whole dissertation on this premise that there's a problem here that needs to be looked at. There's a problem here in which we need to find some type of a solution. And also, it's very important that you connect this problem to journals and books. This is a problem not only to you, but the problem has been discussed by scholars and by the government, for example. In this section, you should try to define key terms, definitions of your research area. So, this student, in her dissertation on the exploration of barriers to HIV/AIDS testing among Black Africans in London, she's defined and contextualized each aspect of her research aim. So in terms of barriers, she explains what it is, she defines what it is. In terms of HIV/AIDS testing, she defines what it is and she contextualizes it. And also in terms of her target group, Black Africans in London, she really explains what did she mean by Black Africans in London. And the good thing I like about what the student has done They've referenced, every time they've broken down a word or a concept, they've referenced it, they've connected their work to the literature. This is excellent. And more so, you can go one step further. When you break down what does a barrier mean, you can show why did you choose to talk about barrier? Why choose to discuss about barriers? Why is this important? You could have chose a number of areas, access and so forth, but you focused on barriers. Why is barriers essential to this story? Also, HIV's AIDS testing. You could have done a number of different health issues, but you focused on HIV's AIDS testing. Why is this significant? Black Africans as well, like why Black Africans? Why this target group? And also in London, why London? So you can really add further to this. If you just want to do the basic breakdown, barriers mean this, HIV/AIDS testing means this, Black Africans in London means this, that's fine. But if you want to go one step further and put the why in, why the focus is on barriers, why the focus is on HIV/AIDS testing, and why is the focus on Black Africans in London. Moving on to the next section, state the prevalence of the issue. This is very, very important. And a way to do this is that you state the general prevalence and the specific prevalence. In red, you'll see the student has presented the general prevalence, and in yellow, she moves on and makes it much more specific to her target group. So, in terms of the general prevalence, what is the variation in terms of age, in terms of sex, gender, geography, the location, ethnicity, race, and recent history of what's happened with this particular health issue. So this is a very general paragraph which she starts a section with, but then she moves on and she talks about the specific prevalence, focusing just on her target group, what is happening right now. So she moves from the general and she moves on to the specific, and this is a very good format to employ when you're writing about the prevalence, when you're writing about factors, when you're writing about the outcomes or implications. You start very general, then you move on to specifics. Moving on, the next section, you would state the main factors that led to the health issue. The example that I've provided in the template is an example from a dissertation on the analysis of poverty as a determinant of childhood obesity 4 to 11 years in London. And this student has talked about some of the main factors that lead to childhood obesity. Childhood obesity is indicated to be caused by consumption of excess calories, which creates an energy imbalance in the body. Likewise, you will talk about the main factors that led to your specific health issue. After this section, you'll state the implications, state the consequences, or state the outcomes of your health issue. And I've provided another example of a dissertation on childhood obesity, and they state the outcomes or the implications or the consequences of this particular health issue. Likewise, you should do the same. And moving on to the next section, what is the government and non-governmental organizations currently doing to address the issue? What's happening right now? What activities is the government doing to tackle your particular health issue? And I have an example again from our childhood obesity dissertation. And I've also mentioned non-governmental organizations. We always generally mention the government, but it's also good to know what significant action is taking place by non-governmental organizations. Next, if you are engaging in any particular theory or framework or model, please state this within the introduction, but it has to be a very, very significant engagement, a very, very significant use of a particular theory, of a particular model, of a particular framework. For instance, this student is using this life cycle, and this plays a major role in her dissertation. So she explains it briefly within the introduction. She briefly explains what the model is, what the life cycle is, what the theory is. Then she justifies the use of this theory, why this theory, you could have used the social determinants of health, you could have used the health promotional model, but she used this particular model, and she explains what it is, and she explains why it is important. Moving on, the rationale. The rationale acts like a kind of conclusion where you bring in all of your arguments. This is where you substantiate your thesis, you substantiate your dissertation. And most people would talk about the prevalence, and they'll use prevalence as an argument that their research is necessary. And also imagine that you are a barrister putting a case forward. So you may talk about prevalence, you may talk about the lack of literature, but be very careful. If your rationale is a lack of literature, make sure that there is a real lack of literature. In this case, some of the cases that I put forward, the lack of literature was a cause for the research to begin. There was a lack of data, a lack of information, a lack of specific information. So this was a rationale for the research. And this is one of the arguments that the student put forward. Or you may be offering a new model or a new framework, or you have new insight, new data is being released. You want to shine light, you want to shed light on a particular issue. This accounts as your rationale. And this last paragraph of your introduction, you should really put forward your argument. This is perhaps the only critical analysis that would be in your chapter 1. This is where you really put your argument across. You bring in everything you've discussed in this one paragraph, and you state your rationale for the whole project. And also, to add to this rationale, you can state the rationale for selecting the target group if you haven't done so already. So not only the rationale for the whole project, but the rationale for selecting the target group. And I brought some examples of this. The last segment of chapter 1 will be your listing of your aim and your 4 objectives. The aim in this particular example is an investigation, or to investigate, breast cancer screening uptake among BME women in England. The aim is very, very direct and straight to the point. The aim of this study is to investigate breast cancer screening uptake barriers among BME women in England. Very straight to the point. We all have an understanding of her sole aim. And she has listed 4 objectives. And your 4 objectives will be somewhat similar in the sense that you will talk about prevalence, outcomes, government intervention, and so forth. And if you see in this section, I've given you a number of examples of aims and objectives. Moving on, just to give you a much more simplified outlook of what your aims will look like. So the aim of the study is, and you change your research statement into your central aim, and then you'll talk about the objectives of your study. And first objective would be around prevalence. This will be followed about factors, and also to explore health implications, outcomes, and so forth. And lastly, to evaluate government strategies to tackle this particular health issue. A very, very simple format that most students will use. Aim and your 4 objectives. And this is how you will end your chapter 1. Just a recap and just a summary of what we've been through. Reference as much as possible. At least 2 to 3 references for every paragraph. And this section is very little critical analysis. Save your critical analysis for your literature review. You just want to give a general overview of what's happening. And be very strict when you're writing. When you're discussing the definition, just discuss the definition. When you're discussing prevalence, just discuss the prevalence. When you're discussing the factors, please just focus on the factors. And if you're looking at the implications, just look at the implications. And when you're looking at the government intervention, only look at the government intervention. And if you're talking about theory, please just discuss the theory. And that rationale paragraph, focus your energies on writing a very, very good rationale paragraph, because your entire dissertation sits on this rationale paragraph. I can't emphasize that enough. Thank you for listening. Please, 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 I can't emphasize this enough. Engage with your supervisor. From my time here, most projects have ended badly if the relationship with your supervisor has ended badly. If you have a good relationship with your supervisor, try to make that connection, then hopefully you'll have a good project. And if you have any questions, please write all questions into the comment box and I'll try to respond. Thank you for listening.